Hello all, we will be starting in a minute. We're just waiting for the judges. I think they're getting briefed on the process and we'll be able to get started. However, in the meantime, I think that this could be a good time for me to go through the logistics of this event for you. Okay, so I'm going to ask you all to mute. So the way that this will work is we're going to, this is the judging criteria. Remember, it's impact, innovation, implementation, and presentation. I will introduce the judges when they arrive, but in terms of the logistics, remember this presentation will be recorded. The one member of your team will present. However, you can help with Q&A. Just a second. One member of your team will present and they will have the 3 minutes to present. During the 2 minutes of Q&A, one or more of your team members are allowed to join and help. In addition, I'm going to make Alfonso will be assisting me and he is going to be my co-host. I just made him the co-host, so he'll be able to help manage this. You'll have 3 minutes to present and then 2 minutes for Q&A, like I mentioned, where you can have your teammates help you. The order that you're going to present in today has been randomized, so it doesn't matter whether you submitted early or late, it's a random order. You will see on the slide, we will say which team is presenting now, and it will tell you which team is presenting next. So you will have those 5 minutes while the last team is presenting to prepare. If you will be presenting for your team, I will ask you to please raise your hand. If you remember how to do this, go to participants and raise your hand. And then when it's your turn, I will unmute you and you will have 3 minutes to pitch. I will be flipping your slides, so when it is time to change slides, please signal to me that it's time. I will give you a 1 minute warning when it's your time, when your time is almost up. And I will do so in my camera. I will not say words because I don't want to distract you. So it will look like this. I'm just going to hold up a 1, okay? When you have 1 minute left. And then I will cut you off when your 3 minutes is over, and the judges will have 2 minutes to ask you questions, okay? Please put your hands down until I've told you that your team will be presenting. We don't need any hands up right now. Please, I'm going to put all your hands down. Okay. So with that, I'll ask Alfonso to help me in managing the hands. Could you, Alfonso, help me to put the hands down?
I'll do that, definitely, Victoria. Hi, everyone. By the way, my name is Alfonso Martinez, MBA student at MIT as well, part of the organizing team of the MIT COVID-19 Challenge. This is an incredibly, like this, the outcome we've had in this event has been incredible. We hosted a similar one that I know we have some familiar faces that participated in it earlier in April, and it was a great success. And that essentially we used that to make it even better and more organized this time around. So it's very, very exciting to see that we have such a great outcome for this Africa-specific event, and I'm super excited to see these presentations. So quick question on the hands, comment on the hands, I'll be managing that. If you have any questions, please let me know directly. you can ping me on the chat window and you can select my name in the drop down and write your question to me and I'll respond.
Thank you, Alfonso. And so with that, it's a reminder, we're track H, we're producing PPE, and we talked about the judging criteria. Are our judges on the line yet?
I am Antonio Grillo.
I'm here.
Okay. Antonio, David, Felicia, Chibuso, and Ashvina.
Hi.
Hello. Thank you and welcome, and thank you for joining us. We're very pleased to have you here. And I will ask that I know that you've been briefed on the process. So for our participants, these are your judges. I'll give them each about 10 seconds to say their name and welcome, and then we'll get started. Chibuso, can we start with you? Okay. Thank you. We have Chibuso here. How about Felicia?
Hi, everyone. I'm Felicia Penting. I am the chair of the IE Africa Center, which is based in Madrid, Spain.
Thank you for joining us. David?
Hi, David Caplupo. I'm an assistant dean here at MIT in our global programs and very excited to be here. Thank you.
Thank you. Ashvina?
Hi, everyone. I'm from the Collaborative Africa Budget Reform, but also an affiliate at Harvard Berkman Klein Center for Internet and Society. I work mainly with African ministries of finance.
Great, thank you. And Antonio?
Hi everybody, Antonio Grillo from Portugal. I'm head of Department of Mechanical and Industrial Engineering, and I'm looking forward for this session.
Great, thank you all so much for joining us. And as you're aware, they'll be taking notes during the 3 minutes, participants, and then they'll have 2 minutes to ask you questions. I'm gonna ask that everybody mute themselves while we get started here. I think Chibuso might be having a few connection issues. All right. So we talked through the logistics. Okay, so now it's your turns to present. We're gonna get started, and we have a lot of teams to get through today and not a lot of time. So I'm going to ask everybody to please be quick in your transitions and be ready to go if you need a backup team member. But remember, when it's your turn to present, you will raise your hand. I will say your name and then you can unmute. You will have 3 minutes to present, and then you'll have 2 minutes of Q&A in which you can ask an additional team member or two to come and join you. All right. So with that, the first team up, we have Honey Guide. All right, Carlo, I have unmuted you and you are able to turn on your camera if you'd like.
Perfect. And on my camera, if you can see me, I have a next sign for you to transition.
Okay, perfect. All right, whenever you're ready.
So our team name is Honey Guide, which is a reflection of the bird with a very peculiar behavior that leads animals and human beings to honey sources, and also forces repercussions if you don't share in the spoils of the honey. So what we're producing is an ability, onto the next slide, please, is that there is no robust measure to ensure the quality of products used inside Africa. So right now the therapeutics are about 16 to 44% that are fraudulent or really low quality. Masks like PPE, we can think about decent N95, but elastic band might be degrading to reduce a decent fit. And what we're going to focus on is the diagnostic reagents, the essential supplies to do the diagnostic testing for COVID-19. So our solution is a data-driven framework to allow Africa to be a global resource in product quality control. This dashboard that we created can allow providers, if I was a provider, I could log in right now to figure out what products are actually being screened by the FDA through site inspections. And more importantly, what products are actually being overlooked from FDA site inspections. So as a healthcare provider, I can look up on the map right now, this is Tanzania, which health networks we should highly indicate where we should have higher testing, as well as what products we should prioritize testing as opposed to testing everything. On to the next slide, we can think about step 2, is then looking at the local resources on the ground to figure out what equipment exists in these facilities nearby those hospitals from step number 1. As a healthcare provider, I could very easily, through the Honey Guide system, figure out where there's high performance liquid chromatography, spectral imaging, and mass spectrometry to figure out if I could potentially not have to destroy the product to get quality testing, or to see if the actual lot is consistent from lot to lot. And we can actually partner with local organizations and governments that are allocating resource to allow this quality control testing to happen in a much more rapid fashion. So going on to step 3, this is where we currently are today. We have the FDA and a few handful of sources that are doing obligatory testing and site inspections at the manufacturers at the sites before they make it into Africa. About 80% of products are being imported into Africa from India and China. And we're crossing our fingers that those products are maintaining that compliancy at the honor system of the manufacturers. Going on to the next slide, we can go ahead and see what we're producing is now allowing to sustain a novel gig economy by using trained resources and graduate students and potential faculty to do this confirmatory testing on the ground, and potentially using Honey Guide to slowly pull away the resources and financing of the products being sent to India and China to eventually allow Africa to utilize its existing manufacturing resources to potentially allocate that funding, stimulate economies, and produce potentially better products. For COVID-19, this is absolutely essential for the diagnostic reagents that are being used, and we can use the same principles to start testing for the PPE, and within 1 year context, hopefully start doing the same efforts for the antivirals and vaccines for COVID-19. We're supporting every patient that gets infected, the 3% that are going to potentially die, and more importantly, the 97% of immunocompromised patients to sustain life.
Time. Okay, 2 minutes
Next
for
slide.
questions.
For the team. If you can just go one more slide. Thanks. Questions? If someone's talking, I think they might be on mute, and I can keep using my time until a question pops up about making sure that we are supporting.
Apologies, Carlo, no more, just quick Q&A.
Got it.
Hello, can you hear me?
I can hear you now. Yes.
Hi. Thank you for this presentation. It's, fighting counterfeit drugs or substandard medicines is such an important thing in Africa. And I know you've mentioned the figures of 15, 16%, but a lot of people actually think that it's higher. So there are a couple of products already in Ghana, for example, that kind of seem to be doing the same thing that you're presenting. How is your product unique?
Yeah, so prioritizing the ability to do testing that's non-destructive, as opposed to just relying on mass spectrometry where you ruin the sample, and also putting in some logistics to say, is this product better than nothing? And if it's better than nothing, how does it compare when I actually have 2 options available? So instead of just doing the testing, our dashboard and using some proprietary algorithms, we can then assign that logic to let you know what's better than nothing and what's the risk when thinking about a healthy patient versus a really critical ill patient. Does that answer your question?
Yes, sure. Thank you.
No, thank you for the pointed question.
Hi, this is David. Just in terms of a competitive analysis, in terms of what other entities would be probably following or trying to outdo you, any thoughts on that in terms of what's
That's time, unfortunately. Thanks
David,
for the
thank you for your
question.
question.
All right. Thanks, Carlo. You can mute yourself now.
Thank you.
All right. Auto hand washing team 038, you're up. We're looking for a hand. Okay, Faremi. Faremi, you have the floor. Let us know when you're ready.
I'm ready.
All right.
My name is Faremi Bolatife, and my team lead is called Judith from Uganda. We're here to propose a solution to eliminate cross-contamination and recontamination of end users among public users. Our problem statement actually came out from a review we did into past literatures that informed us about contamination of public land users when they contact equipment, and there are other challenges such as high maintenance due to mechanical moving parts. As a result of that, we came up with a solution to design a system, an automatic system that actually reduces or eliminates the need for you to touch your hand sanitizers. All you have to do is to present your hand on that at the dispenser point, and the sanitizer placed within the system will be dispensed into your hand. One good thing about our system is it also allows for resource management, because it allows for resource management, especially when users don't use the recommended WHO's 20 seconds. As a result of that, our target markets include hospitals, churches, mosques, and so many other places that include high congestion areas. And one good thing about our system is that it also gives the government the ability to predict or anticipate areas where low hand usage has been occurring from the devices. And because of this, we came up with a cost-effective solution that has that considered the availability of solar power and reusing of existing supply chain. Please, could you go to the other slide to see the proposed system? Also would assist the government to also eliminate and ensure we believe that the system also ensure other end users the ability to gain reliable access and use it. And our system also provides, it also supports disabled people, especially those who can use their leg to mechanically operate tippy-tap systems or existing technologies. Slide 6 shows how our system works, and slide 7 also shows how the data is being moved from the device through the government to get an assessment, then go back to the community to encourage the use of these devices to prevent further contamination after lockdown, during lockdown, or before, or
Time's up for
during
Annie.
lockdown and after lockdown. Thank you very much.
Thank you. Okay, we have 2 minutes for questions.
This is David. Could you just quickly talk about the distribution again, in terms of any challenges?
Okay. In terms of the challenges in existing solutions, the existing solutions have manual contacts, which are highly prone to contamination. Also, existing technologies also have high maintenance due to moving parts. Furthermore, existing solutions, they don't consider disabled people, and most facilities installed in places in Africa have designated points not supporting gender equity. So our system actually brings a reliable and accessible product to the communities in Africa at different bus stops or locations where they can easily place their hands under sanitizer, wash their hands, whether for 20 seconds or less, and go away. And the good thing about this system is that
Can I add that point of saving resources, because the water only pours as long as your hand is under the outlet, and when you remove the hand, the water stops coming out. So we save resources with our system.
Okay. And it goes a leap beyond the existing technologies by giving governments the ability to monitor compliance and to evaluate how the behavioral patterns of different locations where these systems are placed, and how to encourage community users to keep using to reduce COVID-19 and to ensure there's no further contamination in the country or in any African nation.
Yes, that's it. Any more questions?
Actually, yes. Can you talk just a bit more about this gender element, please?
Okay. The solution comprises the solution itself. It's an automated system.
Thank you, team. That was wonderful. There was a lot of questions from the judges, but hopefully we can get those answered. later date. All right, next up we have Team SOAPY Spirits Initiative. And after that, we'll have Team 23 Gabeta Elu Platform for All. Okay?
One item, Victoria, before we move on quickly for the judges, if there are items that you wanted to mention to the team but weren't able to do so, please feel free to write it down in the form that you populate. You should have space in that form to provide feedback to the teams, and that is incredibly valuable for teams after the event.
Okay, I'm sorry, just quickly, are we populating these forms as we do this, or can we take our own notes and do it at the end? You have to do it, right? Okay.
You could do it at the end. You could do it at the end as well. We'll make them available later on.
Okay.
So Hector,
Yes.
Are you ready to present for Team SOAPY Spirits Initiative?
Yes, sure.
Okay.
So I'll be snapping my finger for the next slide, right?
Okay, perfect.
Yeah.
All right.
You're right.
Start going and I'll start timing.
All right, thank you. So from SOAPY Spirits, this is Hector Chidiman from Malawi. Next. The first slide. Hello? All right, so the challenge that we are working against is actually the lack of low cost and effective disinfectants. So if you go around the supermarkets, you find that we are running out of these disinfectants, and where they are available, they're not actually affordable to most people. In Malawi, we're talking of 80% of operations that are in rural areas who can't afford these disinfectants. Yet World Health Organization recommends that we improve personal, communal, facility hygiene to help curb the spread of COVID-19. So our solution is actually to use the available infrastructure, distilleries that have been closed down now for as one of the restriction measures to prevent the spread. So we'll actually repurpose these to actually help produce more and save different markets or different individuals who need them. By doing this, it will help us break the spread of the virus. Next. Yeah, so what we are going to do is to identify distilleries, build partnerships with government and regulatory agencies, and create or capacitate these distilleries to actually produce high quality and validated disinfectants and antiseptics, and then using the available existing channels of distribution to actually reach as many communities, households, and facilities as we can. Yeah, so possible disinfectants, we already know that there is an influx of hand sanitizers on the market, but with our partnerships with governments and regulatory agencies, so we'll leverage on the already existing goodwill to produce more of this, but now ensure that there is quality and guaranteed effectiveness. And we are also going to improve the scale of distribution of breach solution, which is already approved by World Health Organization. I was used previously in the prevention of Ebola, and DRC is being used at the moment. So actually also help split out in the scale distribution of these products. Yeah, so for rural communities, the distribution, we are going to focus on actually packaging the soap in large containers where they can be used in communal spaces for hand washing, and also promote, as you see in the picture, a hand washing system that can be made from local available resources called a tippet tap. And for maybe high-end customers, we are going to actually focus on producing hand sanitizers that can be used, packaged and used in place of water and soap. Yeah, so for the community, we expect that we are going to create employment. We are going to create employment and also improve local supply chains for these, because we are running out of supply at the global level and even at the local level. And this is going to help us reduce and prevent the spread. For the shareholders, the owners of distilleries and others, they are going to improve their revenue generation. And also we are going to transform them into socially responsible businesses. Thank you.
2 minutes for judges' questions. And Hector, I can move to a different slide if you'd like.
Yeah, these are just the metrics, and then the last one is actually the team. Yeah, sure.
Hi, Hector, it's Antonio. Just to be sure, you believe that this should be sold or should be delivered freely? Who's going to pay for this?
All right, so yeah, I have a team member who is going to take the other part of the question, but we are going to actually produce more of these, and then leveraging on the economies of scale, We want to, because people are already buying, they will still buy, there's still demand for this, but the cost is actually high. So we want to actually produce this using local available technologies. Like for bleach, it's just basic salt and water. So that will make it a bit cheaper for everyone to actually access. If you can get maybe cross subsidies, we should be able to even distribute to those who can't afford to buy.
Okay, thank you.
Yeah.
Hi, Hector.
Hi.
How fast do you think you can get this up and running? Because as the number of cases are increasing, it's going to be more pressing.
Yeah, thanks for the question. So for bleach, we are not actually inventing any wheel. These are products that are already on the market. It's actually a partnership with WaterStep, which is already actually using this product elsewhere. So we are not going to invent the wheel. It's already on the market. It's just a question of procuring and then using the existing channels to distribute and make it available to people, facilities, and whoever is actually in need of them.
Okay, question. So about how long do you think that it'll take to retrain this workforce to be able to make these products from having made beer previously?
Come again on the question?
Yeah, so about how long do you expect that it'll take you to retrain these workers to make these products?
All right, so for example, on the training.
Unfortunately, we're out of time, but again, as Alfonso mentioned, this is great feedback and you'd love it if you could share it with the teams. All right.
Actually, I wanted to add to the commentary made earlier. I think I wanted to clarify. The scoring card that judges are populating should be populated as the presentations go, since the deliberation post this session will happen very quickly. So we won't have a lot of time to go back to revise scoring. So please score and complete the forms immediately. What I meant earlier was the feedback provided for teams could be elaborated upon further. So post the session. So we could go back and provide further feedback for the teams, which is very useful. But for the scoring in itself, let's do it now. Sorry, Victoria, back to you.
That's okay, thanks. I'd like to see a hand for Team Gebete Le'elu. Okay, Beth. Go ahead, Beth.
Yes, hi. Hi, everyone. My name is Beth. I am with Team Gebete, which means Platform for All. And next slide, please. Protecting from the effects of COVID-19 is our mandate. And the obvious effect of COVID-19 is the health effect. But what we are proposing, sort of an economic vaccine, that will be a solution to the impact on the supply chain. Next slide, please. The solution we're proposing is one that creates a shared economy for the supply chain. It's sort of an Airbnb-like response for B2B matchmaking across the supply chains. So enabling manufacturers to pivot into personal protective equipment manufacturing and connecting buyers in real time is the solution. Next slide, please. I'm not sure if I presented accurately what the problem statement is. It's a disruption of the value chain that we're trying, just going back to our problem statement. And the basic elements of the problem that we are proposing to tackle are the disruption of the individual's livelihoods, the lack of know-how for the manufacturers to pivot into manufacturing PPEs, the lack of coordinated responses to the national, centralized responses to the national problems, the lack of the ability to make digital payments, and the long-term economic shocks. So if you can go to the vision and roadmap slide, slide 4.
Yeah, it's on that slide.
So our vision is creating a virtual marketplace that targets the economically at-risk small and medium-sized manufacturers, allowing them to pivot into producing personal protective equipment. The roadmap that we foresee is piloting in Ethiopia, targeting the textile and garment manufacturing value chain. And the phase 1 would be onboarding the raw material suppliers and the manufacturers. And initially, it would be in English, but with a plan to translate into local languages. A key element of this will be the digitization of payments, which will be integrated paying capabilities that also establishes the credibility between the players on this platform. The next 4 slides are actually, if you can go quickly through them, they outline how the interactive platform will work. So the slide that's a unique value proposition, which is slide 9, this is our unique value proposition.
Apologies, time is up.
We have a local context. Okay.
Thank you. But there's 2 minutes for questions now.
Victoria, can you please move to the next slide? And the next one, to the unique value proposition.
Thank you.
Do we have any questions?
Yeah, I have one question, just to be sure. So this is a digital platform that you try to pull together suppliers and manufacturers to pivot what they are doing in terms of production to this type of PPEs. Is that correct?
Exactly. So if you go to the next slide.
That is correct.
Yes. So in terms of our core business, that would be early adopters, really targeting the Textile Garment Association first, also chambers of commerce, and then we see financing and end user financing partners as well. But we're phase 1 focusing on the buyers and the suppliers. Sorry, Beth.
Okay, but just to be sure, it's a platform specifically for that. There's not, how does it differentiate from existing platforms from traditional e-commerce?
Right, so it is also enabling these manufacturing firms that want to pivot into PPE production, but don't necessarily know how. So they don't know the regulatory requirements, the protocol,
right, okay.
Specifics. So we're supporting them with that as well, and then connecting them to markets.
Okay, thank you.
Okay, time's up. Thank you so much. Next up, we have, Team 8, Connect the Chain, and after that, AFKATHON. Would a member of Team 8 please connect the chain? Please raise your hand. Rob.
Good afternoon. Can you hear me okay? Hello?
Yes, we can hear you perfectly.
Okay.
Whenever you're ready, just
Amazing.
tell me, just say you're starting.
No problem. When you're ready. Okay, good afternoon. I present to you Connect the Chain. So this is a team that I've been working with over the weekend, a real diverse team from 6 different countries across the world with a real diverse background. However, I won't spend too much time talking about us, but I want to get straight into the problem. Next slide, please. So the problem that we're looking at here is ventilator availability. Now, we know that COVID-19 is really causing havoc in the world that we live in today. And in Africa, there are currently 42,000 active cases of COVID-19, which requires a lot of ventilators to keep people alive and keep people breathing. If we look at America, for example, they have a ratio of about 1 ventilator to 2,000 people. Press next, please. But this is much more dire in Congo and in South Sudan. Next again, please. So that's 1 to 17 million and 1 to 3 million respectively. But this isn't even the worst of it, because there are 10 countries in Africa that don't have any ventilators at all. So in order for us to tackle the impeding problem being that there will be more cases of coronavirus coming up in the future, more ventilators need to be made. And hence we want to talk a bit more about the manufacturing side. So we go to the next slide. All right, so here I've highlighted some of the areas. So I've listed 3 common products. So we've got a monitor, a vehicle, and a ventilator. All of these products have a large number of components that are embedded into it, and hence also a lot of suppliers that need to produce these things. However, for manufacturers who are new into the industry of making ventilators or pivoting away from doing their current business into ventilator production, they may not necessarily understand the supply chain. Next slide. So this is where Connect the Chain come in. Connect the Chain links and connects manufacturers and suppliers, giving semi-real-time information on capacity, capabilities, and location. Next slide, please. So as I said, it's a cloud-based platform that is data-driven. And one of the real core benefits is that it can utilize the local supply chain, giving manufacturers a good indication of where the local suppliers are and what they do. And this can help maximize the capacity in these plants and help reduce unemployment and also reduce the manufacturing costs. So I'm going to go through a demo of what this may look like. So here's a landing page of what this platform may look like. And you can identify the manufacturer or supplier. Next, please. And then register all your details, what products you make, what sort of supplies you're looking for. Next slide, please. And then you can now filter using a parametric filter, a range of different things that you're looking for, be it material or location, for example. And this is the real gel that keeps it all together. Next slide, please. So this ultimately is sustainable because it's revenue generating and it supports manufacturers that want to pivot and also can survive and thrive post COVID-19. And its innovation comes in the fact that it's a one-stop shop for manufacturing supply chain, and it can work, and not just in this particular pandemic with ventilators, but with any product. Thank you very much.
Great, thanks. 2 minutes for questions.
Rob, this is David. Just quickly, are there any thoughts about there could be tax implications, could be security implications? I know we try to do this in Latin America, and with a government and things like that, restrictions. Is there like a connected chain throughout some of these political stops that may happen in terms of customs and things like that?
Yeah, so I guess this platform is only going to be connecting just the information about these particular suppliers and manufacturers. So there will be no products that will be changing hands, no actual goods, as it were, but it's just about giving more exposure to what's available in your locality. And I guess even further out as well, if that's what you want as well. And hopefully the backing of the government should be there, as we want to utilize the government infrastructure to be able to get a good understanding of the companies that currently exist in that marketplace and in that area. And hopefully that should all bring everything together when it comes to execution.
Thank you.
Hi, okay, question. So, I think that we have seen some things like this happen on the market, and they oftentimes struggle because these machines are very expensive to maintain and they're tough to use, right? So does your platform deal with this directly?
Not directly. So the platform, I guess, in its essence, is just cloud-based. When it comes to the machinery itself, I guess there could be other capabilities built around the expertise that is gained with working with a range of manufacturers and suppliers across the world. But I guess as an initial concept, that isn't necessarily something that we've considered yet.
Okay, thank you.
Rob, it's Antonio. Just to be sure, the idea is that you convert existing manufacturers to produce ventilators, or you want to use those that already are producers of ventilators and connect to suppliers and to those that are in need of the ventilators?
Time's up. Great questions. Hopefully you can connect offline and keep going with this awesome project.
Definitely.
Thank you.
Thank you. Okay. Next up, we have AFKATHON, and I saw a hand. Yes, I will unmute you. You are ready to go whenever you're ready.
Okay. Can you hear me?
Yes.
Okay. Perfect. So we can start. I'll be raising this. I hope you'll be able to see it for next. The first slide, please. I didn't see it. All right. Okay. So we are Team AFKATHON, and we are here to flatten the curve. As you can see, we wanted to come as 28 social entrepreneurs to the competition, but we ended up sending 3 representatives, and we got 2 from here because of the competition rules. Because of the global shortages of masks, prices have skyrocketed, and masks are now inaccessible to vulnerable communities like rural areas, and this has seen the introduction of, or others have resorted to picking up dumped single-use masks for reuse or for resale. And this boy went viral in a video when he tried to protect himself against COVID-19 using a grass mask. Thousands are infected, and thousands more are affected, and yet millions are still at risk. Then our solution, we are going to be using the glucometer strip model, because our mask will be coming in 2 parts. So we'll be having the community graded mask and the medical graded mask. The community graded mask will come with a spray, which will be like a nano spray to have antiviral and antimicrobial nanoparticles that will be sprayed, so it can be washed, it can be boiled to remove the particles. Then you can spray again when you want to use. And when it comes to the medical grade mask, it comes with a recyclable mask, and it comes with a filter. Then, so we embrace nanotechnology. Then we are going to be using automated pilot lines and reusability, collaboration, decentralization of production, so that we can reduce the cost. Cost per unit will be something like $2. And if you use it many times, it's very cost effective. In the distribution, we are going to be using the USSD for customer update requests, order confirmation, payments. High risk areas will try drone delivery. Yeah, so we'll try drone delivery, and after drone delivery, we can also leverage on the distributions that are there already for food and other products, so that we can be delivering these masks, because masks usually are not heavy. Yeah, thank you.
Perfect timing. Okay, 2 minutes for questions.
Hi, Chibuzo. Could you talk to me about the technology to recycle the medical masks?
Again, you were breaking.
Talk to me about the technology to recycle the medical masks.
Okay, so the technology to recycle the medical mask, could you please go back to the slide with the 2 different masks? Okay, so the technology to recycle the medical mask is simple. So the first thing is we are going to be having a filter, and the filter will be a replaceable filter, and the filter will be biodegradable. So it will be reacting with carbon dioxide as you are breathing. So it changes color from white to purple as you are breathing, prompting you to change it. Then you take it, you can put it into a sanitizer or a sterilizer, just like we do all other hospital equipment. Then you put a new filter inside. That's why we are talking of for the glucometer strip, because the filter will be like the strip, and the mask, because it works many times, it will be like the glucometer. So we'll be producing more of those masks, more of the filters, then the mask will be working over and over again. I hope that answers your question.
Sorry, what would be the cost estimate of the new filter machine?
Again?
What would be the cost estimate for the filter machine?
Okay, so the cost of the new filter machine, it will be like the sanitizer. It will be say 10,000–20,000. That will be the range that we are looking at, because these sanitizers are not too expensive. That's the cost for the. Okay.
Thank you very much. Thank you for the questions, judges. Okay, so I see Antib COVID-19 3D print Austria or Fataki. I'm not sure which is your first name. You're up. Unfortunately, I'm going to be moving the slides for you.
Okay, no problem. So can I use this one like as for?
Yeah, whatever symbol you want to throw at me, I'll pick it up.
Okay, perfect. Thank you.
You ready?
Yeah, let's go.
Okay.
Hi everyone, my name is Astria. I'm the founder of Energy Generation, which is a Pan-African organization that aims at training young people to become entrepreneurs in the field of energy, health, and agriculture. And when we realized the magnitude of the crisis, how it was spreading all over the world, we first got scared, I would say, crazy scared. And then we start wondering how can we do our part in finding solutions. And it happens that we have a makerspace within our training centers. And we thought that we could participate that way. So we basically set up a small task force, if I can say so, within our organization in order to be part of the solution. And but the entire team is with us on that. So the problem basically that we identified is that like, in many countries, the health system were kind of overwhelmed by the situation, mostly due to the lack of protective medical equipment. And also because, in Africa, it's more difficult to implement radical lockdown. So basically, we thought that we could produce 3D printed solution in order to address this problem and to bring support to the medical personnel. But we identified a lot of issues regarding that, especially regarding logistic and so on. And so what we try to do is to work collaboratively with other fab labs and makerspace throughout Africa so that we can collaborate and have a more collaborative approach. So basically we developed a platform online, 3D print, COVID-19 3D print for Africa, where we had lots of inscription. I mean, people contributed, and over the weekend, in parallel with this hackathon, we managed to gather our community on the platform, on the Slack community platform. We had medical personnel, we had makerspace coming together on the platform. And so basically, we were able to prototype different type of products, but more importantly, we were able to produce capitalization documents with makerspace coming from Togo, Senegal, Kenya, Egypt, Guinea, Cameroon, Benin, and so on, so that we can be stronger together, basically. And we're amazed by the vision. Thank you.
Thank you. 2 minutes for questions.
I asked just, it's Antonio here. Is this platform already developed? Are you in the stage of developing it? What's the status?
Well, it's actually, the platform, it's a web page for inscription and a Slack group that is active since this weekend. And so since Friday. And so, yeah, it's already active, and we already started collaborating with those makerspace coming from all over the continent.
Thank you.
If Victoria, if you can move on with this slide. So the slide, yeah, here. No, the last one. Yeah, here. So the makerspace, they actually produced sheets like that with the product that they're developed and the challenges that they have and the type of funding that they would need. And so now our idea is to gather all these needs and look for funding so that we can work in a more effective way together. Yeah, and we also solved a lot of technical issues that each and every one had. So the platform is already live.
Hi, what was the URL for your platform again?
Sorry, Randy, no questions from the audience right now. Thanks, though.
I guess we can
What's
share.
the URL for your platform?
I guess we can share it on the groups.
That's allowed. You can chat it later. Thanks, Chibusa, for the help.
Thank you.
Okay, that's time. Thank you.
Thank you very much.
Okay, team 42 PPE M&D, you're up, and Cobweb, you're on deck. Looking for a hand.
I did raise my hand.
Great. You're ready whenever you're ready, you can start.
Good afternoon, everyone. So I am from Team PPE M&D, and today we're going to be telling you guys about how we propose leveraging remaining capacities to manufacture and distribute face masks and hand sanitizers to vulnerable populations. Next. So far, we have identified two problems. The first one being that poor people cannot afford PPE. And in South Africa, we have about 55% of the population that live in poverty. That is, those people live in $1.95 per day. In the picture that you're seeing in the screen, you're seeing people queuing to actually get food parcels from the government. And if you look closer, you can see that no one was wearing a mask, and they were definitely not doing any social distancing. The second problem we identified was that hand sanitizers were out of stock in most retail stores. Next. Next. The solution that we're proposing is to source, no, this previous one. The solution that we're proposing is to source raw materials locally and to produce basic PPE locally in the labs or in the universities. So instead of just giving out hand sanitizers and masks, we're also going to give out pamphlets that will be available in English and local languages. And these pamphlets will aim to educate people on how to safely use the masks and the hand sanitizers. Next. In our solution model, we are looking at leveraging capacities in all of South Africa. This includes lab capacity in universities to produce PPE. Universities have the capacity to produce hand sanitizer, and then we will also leverage skills and expertise of fashion students or lecturers in technical universities, which will then produce face masks. We are also looking to leverage manufacturing capacity in factories to sterilize recycled dispensers. PPE will be distributed through community stakeholders like religious leaders or shops. We will use the space available in Texas as they are currently not being filled to capacity due to social distancing protocols. Therefore, Minibus Texas will be used to distribute PPE. We will also develop a source map to keep track of distribution and availability of stock at each location. People can then use web, USD, or SMSs to find collection spots near them. Next. In conclusion, we have found that universities have the labs and the experienced personnel to mass produce PPE, hence saving on training and lab setup costs.
Perfect timing. All right, thank you. We have 2 minutes for questions from the judges.
Do you want to finish your presentation, the last paragraph? Is that okay for my question?
Okay, universities have lab and experienced personnel to mass produce PPE, hence saving on training and lab setup costs. Technical universities have the skills, expertise, and resources to mass produce facial masks. And then providing free PPE will stop vulnerable communities from being infected. Hence, we are saving lives. Thank you.
Thank you.
No further questions? Okay, thank you.
Thank you.
All right, Team Cobweb, you're up. And Matthew, you can unmute yourself.
All right, thank you.
Yes, let me know. So this is team 032 for the judges. All right.
All right, whenever you're ready.
Okay, go ahead.
So our team, Cobweb, looked at the large disparity as outlined by the World Health Organization between the amount of PPE available within Africa. You can move on to the next slide, as well as the PPE necessary to combat this COVID-19 crisis. And instead of focusing so much on the large-scale production of PPE, we focused on how we can distribute this PPE to be most effective, as well as what production methods would be most effective. And in order to do that, move on to the next slide, please. We looked at the case study of Algeria, going off of information provided by nearby PPE manufacturers and suppliers, the World Health Organization, local health experts, and also population demographics based off of the UN. And if you move to the next slide, we came up with a solution called Cobweb. Cobweb is a modeling software that I've been working on with Dr. Brad Bass at U of T that's intended to model ecology or different environments, complex systems. And if you move to the next slide, we have a brief demonstration and I'll go over exactly what's happening. It's just a model intended to represent the spread of the virus with different factors in play, different distributions of PPE, and model different regions within the Algerian landscape, as you saw on the previous slide with those kind of 6 islands. If we move to the next slide, we are able to graph the data from this model and look at how this could affect policymakers and their decisions regarding how to treat the COVID-19 crisis within Africa. For example, this graph looks at the idea of reusable polypropylene fibers to make masks and the feasibility of it by modeling how the infection spreads using these type of masks. And here they're used indiscriminately. Healthcare workers and non-healthcare workers have access to them. If we move to the next graph, we see more of a flattening of the curve here. This is avoiding reusable masks and more so focusing on providing masks to medical professionals only with 30% social distancing. And so we want to use this software as a means for predictive modeling of the COVID-19 crisis and allow health experts or policymakers to use this software in order to map out how the virus would spread and come to conclusions about what exactly they can do. If you move 3 slides ahead, just 1, 2, yeah, there. And basically our end user here would be governments, NGOs, health professionals, policymakers who would want to use this software to have predictive modeling of how exactly they can treat the virus. 1 more slide. And we are able to, it would be completely free to them, no charge, but it's up to them to come up with the funding for providing the PPE themselves, and we have possible partners to do that as well.
Perfect timing. That was 3 minutes. Okay, we have 2 minutes for questions from the judges now.
Hi, Matthew, this is Antonio. Just to be sure, so you're proposing agent-based modeling software for modeling the spread of the virus in different locations. Is that it?
Yes. We want to model the spread of the virus in different locations, graph exactly what outcomes would come from different distributions of PPE as well as different production methods, and then from there.
But for that, you need to have a function that represents the behavior of people, the virus, and all that. You have that already.
Yep, I can get into the modeling of the program if you want. Do you have any questions about the program itself? Or you can go back 1 slide, or keep it at like the team member slide. if you have any questions about the program itself, for example, we represented protective equipment through our orange agents, and these would be exhaustible or they would be able to replenish based on the food that is specified for them. See, it was originally an ecology model. The edits that we made to the software were made to encompass more of a virus-related model that models COVID-19 spread. It made more sense to model the PPE as an agent rather than an object. Any more questions related to the program or larger questions?
No,
abroad?
that's fine. Did you validate it with the hard data from
Yep.
Algeria?
Yep, we based it off of data from suppliers as well as data that we could find about Algeria online from World Health Organization, et cetera, which we implemented into our model.
Okay,
and it can
thank
be
you.
updated for different countries as well.
Thank you.
So who would be doing data entry, Matthew?
Anybody, data entry is actually quite simple. I feel like anybody who's given the opportunity to get the understanding of it, basically, can I pull up, I can't screen share the, I can't screen share the program? No, okay.
Unfortunately, no, and that was time anyways, but it's pretty simple is the answer. Great. Okay, thank you guys so much. That was wonderful. So next up, we have team 25, masketizers, and then we'll have 14 after that, faith for the future. Masketizer is looking for a hand. Itohan, I see you there. Okay. I'm trying to unmute you. Itohan, can you unmute yourself? There you are. Itohan, could you please raise your hand again? Okay, Itohan, you're unmuted, so you can start speaking.
Okay, so I have a paper with the next slide on it. Can you see it?
Okay.
If you can help.
Perfect.
So, all right. So, hi everyone, my name is Itohan. Hi everyone, my name is Itohan Osege, and I'm with Masketizers. Please, next slide. Masketizers, next slide, please. Masketizers is basically to put together to provide PPEs to the rural communities and the vulnerable individuals that we have in our societies. Next slide, please. Now, the problem that we've identified with the COVID-19 is that the less privileged in societies, they are at a higher risk of contracting this virus because they do not have the necessary PPEs to protect themselves. And the market that we're trying to focus on is the less privileged in societies by providing, next slide please, by providing affordable PPEs to them by providing affordable PPEs to them by using alternative pro-grade mask materials and hand sanitizers, such as the use of antimicrobial fabrics, encouraging DIYs and utilizing available unemployed labor as a result of the COVID-19 pandemic. Next slide, please. So the alternatives that we've come up with to the production of pro-grade face masks and hand sanitizers are the use of antimicrobial fabric for the face masks, and also the use of ethanol and methylated spirit as an alternative to rubbing alcohol in the use of hand sanitizers. Next slide, please. Next slide, please. So this is a guide for how we are going to produce the face mask. This is just a outline on how we're going to produce the face mask for this vulnerable individual in society at an affordable rate. Next slide, please. Now, the implementation process that we're going to use are the use of billboards and print media, because the people that we are trying to meet their needs are pretty much illiterate, so they do not have any idea of what social media is or what the internet is. So we're trying to get down to their level and then help them to understand this by using print media and using billboards to advertise that, okay, this is what the virus is about, this is how you can prevent yourself, and these are the PPEs that you can use, and these are where you can get them from. And also use unemployed workforce, and unemployed workforce will be trained to make the face masks and hand sanitizers, and heads of communities will also be brought on board in the distribution and education of the masks.
Thank you. 2 minutes for questions.
Is this hi, this is Chibuza. Is this commercial, or is this sort of like an NGO type thing?
It's commercial in the sense that the face masks and the hand sanitizers were made at affordable prices to the vulnerable individuals. Okay. Can you hear me?
Yes,
all right, so it's commercial in the sense that the face masks will be made available to the to the masses at affordable prices, so they do not have to go overboard or overstress themselves getting the PPEs that can protect them from.
I'm sorry, I don't know who's doing this. I'm trying to clear the drawing, so I apologize. Please stop drawing on the screen.
Are there any more questions?
Sorry, if no one else has a question, oh, go ahead.
No, go ahead.
Sorry?
I was just gonna ask, how are you making money as a business, or are you a going concern, or how does that work? I
didn't
guess
get the
it's
question.
commercial for people making the math. You said it's commercial. How is it commercial for you? How are you making money?
Okay, we're making money by selling the PPEs to the vulnerable people, to the vulnerable members of society.
Sorry, that's the end of time, but please follow up afterwards to get more, well, we'll share more feedback from judges.
Thank you.
Thank you. Okay. Next up we have Team Faith Formation, and Nancy, I see you've unmuted yourself and you're ready to go. So let me know.
Can you hear me clearly? Great, thanks. Okay, so I'll start. My name is Nancy, and I'm excited to share with you our initiative called Faith for the Future. Next slide. So we want to use the influence of religious organizations to mobilize communities for the supply of PPE in Zimbabwe. And the Zimbabwe context is really important for us to start with for several reasons. There is a lack of formal manufacturing capacity, high unemployment, high entrepreneurial capacity, and a high influence of local leadership, such as religious leaders. So let's touch upon the first 3 points a little bit. Next slide. The Zimbabwean economy has been in decline for the last 2 decades, leading to companies shutting down, and also the growth of a very robust informal economy, where people are living off jobs such as being a tailor or being a vendor or some other forms of informal employment. And to that point, there is a workforce that would be ready to be activated in a good way if the opportunity is there. Next slide. So to speak on the authority of religion, 90% of Zimbabweans identify as religious, and the authority of religious authorities is well recognized, especially based on some of up to 15 conversations we had this weekend with Zimbabweans from all walks of life. So that includes Pastor Suleimani that you see on the screen here, who is struggling to reach his congregation at this time because they are not allowed to come to the churches. So he has made a YouTube channel to try and reach them more. So when we rang him up and told him about our concept, he was very excited to collaborate with us. So how are we going to be actually pulling all of this together? Next slide. So we want to form an ecosystem for partners who are focused on production of PPE, with the church as the center of this, with the communication and the physical structure. Next slide. And how it would work is that Pastor Suleimani would send a message to his congregation to look for certain skills, like for instance, tailors, and then they would be brought together at the church and trained with local entrepreneurs who know how to make masks right now, and the government would be involved in the production there. The impact that we want to make is about leveraging local resources, creating jobs, and giving people some sense of health security. Next slide. So what is the future for our concept? Well, the challenges that we're up is quality control for making the right type of masks and government collaboration. And we're looking at next steps of aligning stakeholders around our concept. And the future is even brighter for this concept because it can be replicated across other leadership models and also used to produce other types of PPE. And that's it. Thank you.
Thank you. 2 minutes for questions.
Next slide, please. That's our team. And I will have Daniela and JB come on to help answer questions, if anything.
They can unmute themselves. Go ahead.
So you mentioned several challenges in your last slide. How are you proposing to tackle them?
So can you go back to the previous slide? Yeah, so the quality control, we plan to work with the government and also think about the quality that is coming out from the World Health Organization, and use some of the infrastructure that the government has, as they are doing PPE, but focused right now on essential workers because they don't have a lot of capacity. So we want to pull that into the local production as well. Then government collaboration, one of the partners, NGOs that we talked to this weekend, they have a lot of experience working with government and pulling together proposals as well as getting funding. And I guess I didn't mention that this is going to start out as a non-profit objective. But yeah, that's sort of where we're at in thinking through this right now. Any other questions?
Yes, Nancy and Antonio, you are thinking about selling these PPEs, right?
No.
Just freely distributing them.
Further distributing them to vulnerable populations in the city, yes.
Right. Okay. That's why funding is a challenge for you.
Indeed, absolutely.
Okay. Thank you.
Okay, and that's time. Thank you very much, team.
Thank you.
Next up, we have Team 9, HV20, and then so for judges, this is Team 9. We just heard from Team 14. Coming up will be Team 37, Ripple. And I see a hand from Lambert. I will unmute you. Okay, go ahead, Lambert.
Okay, thank you. Let's start, please.
Next slide.
Oh, so thank you. We are a HB20, which stands for Kilo Ventilator 20, stands for like Kilo Ventilators Design in 2020. Next slide, please. So, as innovators coming from different regions over the Africa with different backgrounds, we come up with this ventilator project. Next slide, please. As the case still skyrocketing all over the world, especially in Africa, you have put 3,907 right now. We are having a lot of death cases, but within these issues, the cases are really skyrocketing because we don't have a lot of ventilators to support the lives of those people who have a low immune system. Next slide, please. So far, if you try to look on different newspapers, even different information, we found there is even more than 10 countries in Africa which doesn't have any single ventilators. But now we have a single summary of few countries showing which ventilator they have and percentage of ventilators. Next slide, please. So far, according to our team, we have done a few surveys for 3 countries: Malawi, Rwanda, and Nigeria, where in Malawi we have less than 70, and in Rwanda we have less than 100. So as you can see, we still need a lot of ventilators in here. But why do we need those ventilators, and why we don't have them? So the reason why those ventilators are so expensive, they require high skills to maintain. They require high power consumption, which some of the remote areas cannot afford. And most of the times, those machines are so heavy, even to move them around, it's really a challenge for the healthcare professionals. Next slide, please. So we come up with a simple concept of ventilator, which can be produced locally with low materials we have. And this was simple design, and we also started working on this design. As you can see, I have some 3D printed model we printed today. Next slide, please. So our goal with this ventilator have to be low cost, less portable, even have to be running on the power. We at least for 24 hours operation. Next slide, please. So this is our roadmap. So we currently are on the prototyping and designing. So we want to start with demo testing and simulator testing just to see if it complies with the healthcare information. And we want to engage government NGOs and doctors for further validations and release the beta version. If everything goes well, we can release the beta version by the next month. Next slide, please. So,
were there more slides? That's all that was submitted.
No.
I'm so sorry. Well, that was time anyways. So I'm sorry. I'll go back. I'll go check for those. Alfonso, can you check for those slides? We'll make sure the judges see them.
Okay, thank you.
Lambert, what can I use my question? Why don't you finish what you were pretend you had the slides there? Anything you want to highlight?
Actually, yes. So far at the end of this challenge, we are looking for the partners who can put some skills on board, and also those people who have the heart of helping the communities, so they can even put some resources, because the research and manufacturing of these ventilators is not for free. It has to be for cost. So we need some people who can come on board to help us to resource to support us on those resource management. Thank you.
Hi, Lambert, this is Antonio. In the last 6 or 7 weeks, we have been working in my department on making a really low-cost open source ventilator, so less than 800 euros. If you will be interested, I can share with you what we have learned, because it's published in 2 papers that are open, and we have the experience of 7 weeks on working hard on that. And it's all made with available things, electrovalves and everything that is on the market.
Thank you. That would be much appreciated.
So we've seen earlier that there's a lot of spare parts that goes into a ventilator. Where are you going to source your raw materials, and how is it going to work on a pragmatic level?
So far we are 2 people in the tech. I'm an electronics engineer, and we have one of my member who is mechanical engineer. So we want to do everything to be locally sourced. So we want to use offshore components in electronics. And for the hardware, like the mechanical parts, like pump and everything, we want to be using 3D printers, because we have a lot of community around having 3D printers. And even we can recycle the plastic filaments just to make the pump and even the covering. For the packaging, we want to use the plywood, because in Africa, we can use wood for making the packaging in its way, just to make sure the cost still low. Thank you.
That's time.
Thank you.
Thank you. And so Lambert, we're finding the slides, and we'll make sure that the extra slides are shared with the judges during the deliberation.
Thank you.
Okay, so Samita, I see your hand is raised, and you unmuted yourself. Thank you. And you can tell me when you're ready.
Okay, ready next.
Okay.
Good afternoon. We're here today to talk to you all about our solution, Ripple. So in the face of COVID-19, our friends and family in Africa are reporting the dire lack of PPE to stay safe and healthy during this crisis. So how can we repurpose supply chains to produce PPE? Next. For example, Africa is facing 3 key problems: a lack of PPE, millions of jobs at risk, and increasing environmental risks. Next. As a result, we're adopting sustainability as a strategy and have designed a 3-pronged approach to address not only the local production of PPE, but also employment opportunities and excessive plastic waste. Next. To narrow down the problem, we're focusing on Nigeria, where cases are growing rapidly. We're especially targeting the lower income population using small hospitals, clinics, and NGOs that can't afford expensive PPE. Next. The supply chain in question is the recycling sector in Nigeria, and one of the biggest players is WeCyclers, a partner of MIT Sloan that's collecting, recycling, and converting plastic, but into non-PPE products. Next. As a result, we propose partnering with WeCyclers and modifying the supply chain currently in use by reactivating this organization and recycling plants that have been closed during the pandemic, but this time to produce PPE products out of the plastic. So first, we'll ensure collectors and subscribers are safe by sending them WhatsApp messages about safety procedures to take when dropping off waste. To sanitize, we'll soak plastic waste in tanks of alcohol-based solution. This plastic waste will then be converted into low-cost facial shields and isolation gowns, and finally will be sold to hospitals, clinics, and organizations serving the low-income population. Next. So we hope to start off with recyclable face shields, which are actually currently being crafted in homes in other countries, but our sustainable approach scales this simple process using large recycling plants. Also, isolation gowns can be made from plastic sheets made from plastic bags, and we want to use branding like the tag picture to increase awareness. Next. In order to ensure proper sanitation and keep wearers of our product safe, we'll also provide a care manual like the one featured to our buyers. Next. And finally, we'll partner with companies, part of the Africa Plastic Recycling Alliance, to facilitate scalable, sustainable implementation, as well as MIT's on-the-ground partnerships to raise environmental awareness. Next. So to summarize, our sustainable approach has a competitive advantage to the current PPE production for 5 key differentiating reasons. First, we're focusing on local production instead of importing equipment, addressing the waste problem by reactivating recycling plants on a larger scale than current solutions. We're creating jobs, we're establishing a cheap, scalable system, and finally, we're demonstrating feasibility by using existing local processes, but repurposing them to create simple, effective products. Next. So let's make Ripple happen. And at this point, we'll be happy to take any questions. Thank you so much.
Thank you. Okay, we have 2 minutes for the judges.
This is Chibuzo. Another question. My company deals with over 3,000 hospitals and pharmacies in Nigeria who purchase from us on a monthly basis. I'll be willing to take a lot of these off your hand when you're ready. Thank you.
Thank you.
Do you have a timeline, an average timeline from the recyclable to the actual finished product that you could share?
Yeah, so if you look at a number of slides before, we kind of looked at another company that's really small in Uganda that's doing something similar. And they are able to produce about 400 a day of like the face shields. And this is a smaller company that started like a year ago. And we would be working with WeCyclers, which is 9 years old. So definitely our capacity is bigger.
Thank you.
Any other questions?
Okay. Well, thank you very much, team.
Thank you.
I appreciate it.
Thank you.
Okay. Is my view did it change for you all?
Your view is back.
Is it back? Sorry, since that Zoom bomber, I think it's being weird. Hold on, let me just stop and reshare. Okay, team, is this, sorry, maybe Alfonso can answer this for me offline, but is it coming in full screen for you? Okay.
So we still see your browser URL as well as, but we can see the slides though.
I don't know why it's doing that. Okay, Team Mascade Project, can a representative please raise your hand? Sorry, everybody. I'm just take a moment to breathe. Okay, we just heard from Ripple. Here we go. Okay, there we go. All right. So, Abdu, you ready to present?
It should be me, I think, Tori.
Oh, it's Tori. Okay, so then I'm going to mute. I'm going to mute them. Okay.
Okay.
I'm sorry. I don't know what just happened.
I'm going to try to use, that doesn't really show up. Well, maybe.
Oh yeah, in the corner
We'll
it
see how
did.
it works.
Yeah.
Okay.
All right.
Okay, ready?
Yep, ready.
Okay, so we are the Mascade Project. You can go next already. And what we've built is something called the Mask Reborn Box. It's an affordable, modular, easy to use kit that sanitizes and recharges masks and respirators. Next. So we know the problem, not enough masks, and because of the shortage of supply, they're too expensive. Next. So what we decided to do is we want to re-sanitize the masks. So we needed to build something that is cheap enough, that's easy enough that even an idiot could use it, cheap enough that anyone can afford it, efficient so it actually works, and compliant with government regulations so that hospitals can actually use it. Next. So this is the 4 things it does. It washes. There's a module that washes, a module that adds UV light, and a module that dries. And then what's unique to our product is it's the only one that I've heard talked about that recharges, that actually applies a static charge to recharge the N95 masks. Next. And so we have 2 verticals we're going towards, and we've actually built prototypes that work. Almost 100%, we got them to work over the weekend. So there's one for communities like families, churches, and small community centers that's modular, so you don't need to use all the 4 pieces if you don't want to. Smaller capacity, and we actually are working on hand crank or solar panels. So if you want to recharge it, you can recharge it without plugging into a wall. And then a bigger model, bigger capacity, 6 at a time. This one you can actually run all 4 modules at once, so effectively 24 masks at a time. So we are thinking for funding. We have 4 venues we're thinking about. Government funding. You know, there's a lot of grants out right now for COVID-19. Crowdsourcing, thank you. And we actually have 10 team members. 2 of our team members are in China and have experience manufacturing. So this is ready to go and it'll scale quickly. But we want to partner with African manufacturers to get it all across Africa. And then the 4th option is direct sales. You can go to the next slide. So I talked a little bit about our team. Calamorph is the genius behind this. It was his idea. He brought us all together. Jason is another manufacturer in a different city. Calamorph did the desktop model. Jason did the prototype for the smaller module one. I am a design thinker, presenter, lived in China for a couple of years. And Halima helped make this wonderful slideshow and did market research. Next, it's the last slide. So thank you. You can go to our website. We had a bunch of cool pictures of them prototyping. If you just click on blog or Mascade Project blog, you can see pictures. I'm going to unmute Calamorph Calamorph, unmute yourself for the questions. Any technical questions you might have. Okay, questions? Calamorph, can you unmute to answer questions?
Yes, yes, I'm ready.
Cool. Any
Yes.
questions for us?
What regulatory concerns do you anticipate? This is Chibuzo from Drugstore.
Major
Go, Tori. Yeah,
Oh,
Tori.
So what like obstacles do you think we might encounter?
Regulatory.
Oh, regulatory. So we've tried to follow guidelines as much as possible. That's why it heats at exactly 60 to 70 degrees. So we need to research that more honestly, but we've followed what we believe are the best standards at the time. So yeah, I don't know, that that's a big question right now, yeah. Oh yeah, Calamorph has the machine working in the background, and then also you can see Jason has his kit. There are 2 different cities in China. Calamorph is in Shanghai, and I believe Jason's in Guangzhou. Are you back in Guangzhou?
Yeah, Jason is in Guangzhou, but yeah, he's fighting with his cell phone. I'm not sure. Yeah.
Okay. Yeah, so this is amazing. They came together and built this in a weekend, and all the parts actually work almost exactly. I mean, it's amazing what they could accomplish.
Any other questions from the judges? Okay. Well, thank you very much. This is wonderful, Matt Bade. Excuse me, Mascade.
Thank you very much.
And Manomite, you're up next. George, are you around?
No, it's Hamza today.
Oh, Hamza, great. Thank you. So you have unmuted yourself, so let me know when you're ready.
All right, so my name is Hamza Yagmor, and I'm with Manomite, and today I'm presenting our EMR development system. Next slide. So essentially, an EMR system is a digital version of all the information you typically find in a doctor file. Medical history, diagnoses, medications, immunization dates, allergies, lab results, doctor's notes, etc. Next slide, please. So essentially the problem we're trying to address is that millions of patients' lives have been lost due to stress and delayed attention. Today in the healthcare sector across Africa, we don't have complete EMR systems to combat disease outbreaks. For example, in a situation where medical files need to be transferred, patients can often find themselves in waiting in a queue, which can often be time-consuming and energy-consuming as well. Next slide, please. So the major problems are lack of transparency in data between health systems and providers, inconsistency in availability of data due to power grid and connectivity, poor education available to help workers on how to use EMR systems, and cost of requirements in order to get EMR systems. Next slide, please. So our solution is to develop a cheap and cost-effective subscription-based Wi-Fi enabled EMR hardware system, which is solar embedded with a specialized EMR software solution that provides data management with high levels of security to address privacy concern across all departments. And for future references, it allows research in medical areas such as disease coding, statistics, and predictions using artificial intelligence. Next slide, please. So this is our diagram on data flow. Essentially, it shows the connections of the medical professionals and the users to the routers using the rather WAN or an LAN connection. Medical professionals can review and alter medical data, and then users can send data and view their own data. Next slide, please. So this is just our GUI for our interface. It's going to be accessed by the medical professionals. They can see all of their information on the page. Next slide, please. So our market targets will be government hospitals, private hospitals, both medium and large, and healthcare centers. Next slide. And our market size. So in Nigeria alone, there are over 5,000 healthcare centers in which 10% only have EMR systems. And among that 10%, only 6% has a working system. So the reason being that these systems are so low is because of the problems we highlighted in slide 4. Go ahead, next slide, please. So our market penetration, we will essentially guide the EMR users onto how to use it. So essentially, webinars, free trials, as well as training classes in order to for them to benefit. Next slide, please. And so our working implementation. So we'll be setting up a workspace. Is that time?
Yeah.
Oh, I couldn't hear you. Oops. All right.
That's okay. Thank you. All right, we have 2 minutes for questions.
Hamza, what's the working implementation?
So this is essentially how we're going to be implementing our system with the governments. So we're working with collaboration with governments, but taking guidelines from the WHO, which allows us to be more flexible in terms of customizing the systems for each country. Also, it allows us to run altogether, debug, and perform the final qualifications and set up the hardware systems and installations.
Are there more slides?
There's just the team slides.
Any other questions?
How are you thinking around interoperability with existing DHIS2 platforms, national health databases, and 70% of the healthcare sector is private, not controlled by government, with all of them with different levels and infrastructure, IT infrastructure?
I can't hear you. You're breaking up.
He said, I heard it. He said that, how are you thinking about that 70% of the healthcare system is actually private, and how are you going to work with the data, the public and private data, to be able to implement your solution? Is that pretty accurate, Chibus?
Yes, mostly, and interoperability with other existing systems.
He said what was
interoperability with other systems.
Okay. So
unfortunately, that's time though, but that's a great follow-up. I think.
Yeah, I'll definitely get to you on that.
Yeah, thank you.
All right. Thank you.
Next up, we have PPE Possible, Team 45. And then after that, we have Team 5, Strengthening Supply Chain. Okay, I see Larissa is unmuted and ready to go. Let me know when you want me to start.
I'm ready.
Okay, go ahead.
Hi, everyone. It is my profound privilege to present our pitch on behalf of Team PPE Possible, aimed at utilizing institutions of higher learning to meet the need for personal protective equipment. Next. Vulnerable communities within South Africa often do not have the information regarding the reason for and appropriate use of PPE for the current epidemic. They also often cannot access such equipment due to economic constraints. In March, Rhodes University produced hand sanitizers for their local community with an output aimed at 300 to 450 liters per day. In April, the Durban University of Technology used their 3D printing technology to produce face shields for health workers. With such capacity available at institutions of higher learning, why aren't they all producing PPE? Next. The answer could be a lack of distribution infrastructure. To remedy this, we propose a strategy for distribution with a community education campaign intertwined. Next. Our strategy follows 3 steps. Engage, distribute, monitor. Engage the institution decision makers to gain access to the human resources and systems needed to distribute the PPE. Make use of existing supply chains of essential goods such as bread suppliers Sasco and Albany. Connect with students at the institutions that come from the targeted communities and leverage them as mediating links with community leaders, faith-based and non-profit organizations operating within their community to distribute the PPE. Further, use illustrated pamphlets and person-to-person education of the use of PPE during the process of distribution. Visuals will be most effective since they transcend language and level of education. Then monitor the impact of the distribution using an electronic record-keeping system that tracks the number of units distributed as well as the number of communities reached. Next. The sustainability of this distribution strategy can be attained by a short and long-term model. In the short term, we can engage with pharmaceutical companies and private laboratories to advertise on the products produced. These companies often have marketing budgets and could benefit from the marketing opportunity. Over the long term, we could leverage the higher income population to purchase the products and in using the funds generated, distribute the PPE to the communities unable to access such equipment. From my team, next. I say thank you. Next. There we go.
Great, thank you. We have 2 minutes of questions from the judges. We have no questions. If any judges are talking, you're on mute. No questions? Antonio, did you have a question?
No.
All right, well then, thank you very much, team. This was wonderful. Okay, next up we have team 5, strengthening the supply chain. And I believe, Emmanuel, are you presenting? Then you can, oh, sorry. Unmuted you and you are, let me just turn the timer on and you are ready when you are. Remember, yes. Oh, project 51, Project Adapt, you're up next. Okay, thanks, Emmanuel.
All right, thank you very much. Team H005. We are presenting on strengthening the supply chain system. Next slide, please. It has been shown that there is usually a big challenge in connecting manufacturer to the right source of raw materials to be used for the production of the required medical equipment. By this we mean PPE, we're specifically referring to mask. And at the same time, we see that there is always huge price that is associated with the cost because of the traditional method that is being used. And we also often observe that it is not timely efficient. And that's why we are proposing a better solution that can link both the manufacturer to the raw materials and the consumers to the finished product. Next. This is our solution. We intend to build an app that has the ability to be able to connect the business, healthcare centers, and community together to have opportunity to pull and aggregate orders for the medical equipment. That's what the app is bound to do. After that, it will allow factories to submit their credentials for verification because we are very, very concerned about the security purpose and we want to see how effective everything can be done. So we are going to have a standard verification for that. And then the factory will be enrolled to meet the standard healthcare industry. Those that meet the required regulation will be enrolled by the app. And then it will allow local business owner to participate. We allow that because we want it to be the local friendly activity and want it to be cost effective such that the local people can be able to partner together with it. So this app is responsible for connecting the manufacturing industry with the raw materials and at the same time has sufficient ability to link the user of the mask with the producer. Next slide. Now, this is the concept overview and the way it will be run. in the step. For instance, now let's assume David is the head of a community and is interested in ordering for particular sets of masks. So he's going to request for it as the primary health center leader, as manufacturers who can have ability to access the raw materials through the app. And then there will be quotation that will be sent. And after the quotation is going through the approval, following the time and condition, it will be approved. Subsequently, we're going to assess that the quotation is in order, and then the financial people, fintech platform will be used to assess both in and out and realize that everything is in stable format. And then as the head, now David, for instance, at the head of the community, who actually order on behalf of the community, we have opportunity to also approve the quotation after the verification, and at the same time, the financial people are actually engaged and everything is done. Thank you very much. That's the next slide is the team of the experts involved. You may go to the next slide. Thank you. Yeah, these are the team that are involved in it from Nigeria, USA, and the rest.
Okay,
Project engineer,
perfect.
communicating experts,
Questions
and the
from
rest.
the judges?
Thank you.
Thank you.
Hi. So this is a very commendable project. In many countries, including the US, there have been issues with basically confirming the suppliers and making sure that the products that they're offering are actually aligned with the norms that's required for example, healthcare professionals or doctors to use in hospital. What is the main regulatory hurdle that you envisage, and how fast can you overcome these?
Okay, actually, Mohammed, and you can answer if you are available there, but let me respond to that. We have a standard that we built in the app using the World Health Organization standard, whereby those that want to supply will use their credentials to upload. If they meet the standard of the health in the world that we have uploaded in our app, then they will be subsequently enlisted to enroll on the app. Otherwise, they will not be there. We use this one to ensure that there is a quality assurance among those that will be subscribing to the app. So it's a safe app system. Thank you.
But who will be validating? Who will be part of your team to do this validation process?
Okay, thank you. The system is in automation. We have pre-uploaded the required standard in it. When you submit your credentials, if it does not meet that required standard, you are automatically delisted. So you will not be involved in it. So whoever is able to successfully subscribe is actually certified. So we have put the standard in the format of in automation form to be able to approve those that have sufficient and required credentials to operate in the system. It's automation. I don't know whether you get that, whether I answer that question.
All right, and that's time. Thank you so much. That was wonderful. Okay.
Thank you.
Oh,
Thank
I
you.
should have flipped to,
Yeah.
sorry, I didn't flip to this slide. Okay, so Team 51, Project Adapt, you are up, and I see Samir has raised his hand. You can unmute yourself, Samir. I can help you.
All right. Can everyone hear my beautiful voice?
Yeah. Yes.
All right.
Tell me when you're ready, and I'll start.
We're good. All right. So we've all heard of the Transformers, right? Well, we've got an idea for you. So Ventec and GE, those are two major manufacturers of ventilators in the United States. But when the outbreak came, they were unable to meet demand for ventilators. So what did they do? They contacted Ford and GM, who were able to transform their factories using similar equipment and processes in order to create the ventilators. This not only helped them meet demand, but it also helped GM and Ford, which were out of demand during this time, to be in demand and continue to sustain working capital. Next. So in Africa, there's a lot of industrialization going on. There's a lot of factories in different areas, whether that be chemical, automotive, plane, or clothing. So these companies and manufacturers can easily be transformed to create products like hand sanitizers, disinfectants, ventilators, and even face masks. So that's what we aim to do. This will not only help provide that essential PPE, but it will also help the economy of Africa. So as we can see in this graph, a lot of the people are currently living on a day-to-day basis with lower salaries, So obviously it's very vital that they stay in work. So this is going to help stimulate that economy by providing them work as well. Next, enter Project Adapt. Next. We're a web app that essentially connects small and large manufacturers in out-of-demand industries to those in demand. So what we do essentially next is we're going to create a connection between these companies by allowing manufacturers in out-of-demand industries to list all of their supply chains, list everything they have, create a profile that allows those in demand to see what they have, what's needed, what's required to get those products out of those companies. So that happens through this matching service. There's communication happening, support happening. Then once companies are matched, they identify someone that they're able to go and use their equipment, their processes in order to create this necessary equipment. They go and transform it. So they make those changes. They provide the extra supply chain support, etc. At the end, those non-essential companies, they go and sell those products back to that original company for a profit. So they stay in production, able to provide a payment for their employees, etc. And then those are dispersed by the channels that the existing company already has. Next. So obviously technical details. Quality control, obviously a big concern here, but because the company is actually going to provide those supply chain supports, they're going to provide the regulatory testing, they're going to provide everything that's there, the quality control will be ensured to be the same. At the end of the day, the product that's coming out of these other manufacturers will be with the same name as that original company. So the quality control will be the same. Location could be an issue potentially because these companies could be located in other parts of Africa or even other parts of the world. So for this, we propose a system in which the companies provide teams that go in different areas and help transform those areas, solve any problems, provide support on a day-to-day basis. And lastly, patents and licensing during this time will be suspended by these companies just because they want to provide the support. It's a time of emergency that's needed. Next. So at the end of the day, you can think of it as transformers. Instead of turning cars into heroes, we turn car manufacturers into lifesavers. Thank you.
Thank you. Okay, 2 minutes for questions from the judges.
I'm going to ask my partner, Sanjeev, to help me answer these.
Yes, hello, can you guys hear me?
To me, you kind of rushed the last slide. Would you just elaborate on any other points that you would like to have made?
I think I covered the main points. The main idea is so quality control is taken care of by the original company because they're the ones that are regulating everything, providing the necessary supply chains, like making sure everything is running, the products are up to code, standards, everything. With location, that's the main point that I wanted to make. So obviously, in order to create this bridge, we're going to need to have an increased interaction between the two sides. So in order to do that, we propose that these companies that are producing PPE, they establish areas which are stationed by certain teams that go and help all the manufacturers in that area, big and small, by providing support in like transformation, but then also with any problems that arise and other things that are happening.
Thank you.
Could you speak a bit more about the patent and licensing? Because if I was a company receiving, for instance, if GE gave a local company in Nigeria the IP, how would you manage to claw it back afterwards or manage the production process? Yeah.
So I do not, that's a great question, first of all. I do not know the specifics of how it worked, but I understand that when the larger company, GE, gave permission to the smaller companies to build their machines, it's still considered a GE machine. Like it still has the same exact design and branding. So I would assume it's only like a temporary permission that they would take back after the crisis is over.
Yeah, so obviously the actual the specifics would have to be worked out, but because this is a time of emergency, it's more important that we get what's needed out there rather than thinking about the specifics now.
Thank you.
Thank you.
Thank you.
All right, we have Team Community Action. You're up. And that's Team 10 for the
Okay,
judges.
can everyone hear me?
Yes. And Barakoa, you're on deck.
Can you hear me?
Yes, yes.
Okay, good day, everyone.
Good.
Go on to the slide, please.
Okay.
Next slide. Next slide. Okay, so we found out that Africans are actually quite ingenious. One talk about coronavirus and everybody's making masks. But how healthy are these marks? The World Health Organization made it known that after United States Center for Disease Control said everybody should go around with a mask, they made it known that they are not sure how protective cloth or fabric masks actually are. And a study in Vietnam actually showed that the mesh size of cloth fabric is too wide and it can allow for damp infection. So we thought to ourselves, how can we successfully engage this already existing workforce? Next slide, please. Okay, so hydrophobic materials, we did a little research and found out a group of materials called hydrophobic materials. These materials are materials that are water repellent, and a research conducted by 3 researchers in 2017, consisting of 2 Nigerians and 1 Chinese, showed that these materials have high potential in repelling against antibacterials and things like, and these materials are basic materials that are used for things like vacuum bag. So we thought to ourselves, go to the next slide, please. Okay, we thought to ourselves that, okay, if we could form a force within the community, we could easily and successfully produce the needed materials to people through 3 steps. A, funding of textile industries to produce hydrophobic materials. This funding would come from the government or any major stakeholders. Then B, distribution of these hydrophobic materials to professionals or artisans through channels of local government communities or religious organizations, alongside with instructional materials that will guide them on how to produce these nooks mats. If we move on to the next slide. Next slide. Yes, here we have 2 instructional guide, one in English and the other in Zulu, because we realize that, hello, we realize that the people producing these things are from local communities. Then lastly, they will submit this marks back to where they collected it for sterilization. I also thought of what could we also solve with this initiative. We found out that people that produce these marks, we could reward them with palliatives like food, raw materials, which are very essential in period like this. Further, if you click the hyperlink in this page, go back to the next slide, please. If you click that, yes, we went ahead. Okay, I don't know why it's not coming up, but went ahead to do a survey in a local government in Oyo State of Nigeria, where we asked professionals, artisans, if they will be willing to participate. Exactly, this is the slide, to participate in this kind of activity. And we got positive response from over 30 individuals who also gave the number of nose marks they would be willing.
Thank you.
Thank you.
Okay, 2 minutes of questions for the judges.
Hi, Toluto. It's Antonio. Do you have these producers of textile in your country? Is it widely available, or do you have to import it?
We found, we checked Alibaba.com and we found major suppliers actually, but most of them are from China. Most of these producers are from China. But we thought if the government could spend time to educate the textile industry that we have here to manufacture these things, I believe, because even some cloth materials are already made from this hydrophobic material. So I feel it's something that will be easily produced and will go a long way in protecting people this period.
And what is how much the cost of it? Is it so much higher from traditional textile?
Come again, please.
The cost of this textile, is it much higher than a normal textile?
Okay, yeah, so like I said, we went forward to Alibaba.com and we saw that per kg of this material cost within 740 naira to 974 naira, which is like $2 and some more. $2 and some more. And a standard max is like averagely 20 to 25 grams per single max, which makes that we can make like 500 max per kilogram of that material.
Okay, thank you.
Yeah.
Okay, if there's no other questions, thank you very much.
Thank you.
Okay, Team Baracoa, you're up.
Hello, everyone. My name is Randy. I am in Washington, D.C. Before I begin, I just want to say that I'm very impressed by all the ideas. This is such a great experience. So thank you for that. You can go ahead and start my presentation. So we are Team Barakoa, that means mask in Swahili. And we have created a procedure for creating a locally sourced N95 mask. You can slide, please. So the first major problem that we're addressing is a global one. So that is the N95 respirator shortage that is ongoing in the world. The WHO estimates that we are consuming 89 million masks per month as a species. The price of the N95 has tripled since the beginning of this outbreak, which has put an enormous strain on the African continent. Slide, please. The reason for that is because while there have been breakthroughs and developments in people developing 3D printed masks that can replace N95s, that's not really a feasible alternative for a lot of people in Africa. And the increasing prices make it unattainable for those who need N95s, like doctors and the highly vulnerable, to afford them. Slide, please. So our approach is, so these are the 3D printed masks. This is not our approach. They take about 6 hours to make, cost about $5 each and 100 grams of PLA, which is a pretty difficult thing to get in some parts of the world. And that's for each mask. And you have to have a printer to make this one per 6 hours, which those cost $500. So that can add up pretty quickly. Slide, please. So we have created this method that is cheaper. It's a cheaper alternative to 3D printing N95s with available resources and with a much, much higher output, about 5,000% at scale. And we'll talk about how to use. Slide, please. So this is my apartment. We, rather than 3D printing the mask, each individual mask, we are going to 3D print a vacuum forming box with the mold of the mask, and then use recycled plastics and available plastics to then create the shape of the mask, and then use the similar filtration mechanisms that are being used in 3D printed masks. Slide, please. So this is our MVP. That is the mold. That's my vacuum. And we can talk about this a little bit more in the questions if anyone has any questions. So I'll leave it at that. Thank you very much.
Great, thank you. Okay, 2 minutes for questions.
Randall, what's the, sorry, go ahead.
No, go ahead, David.
What's the production of one of these, like with your contraption? I'm just curious, like the time.
So the plastic heats in the oven for about 2 minutes, and then it's immediate. So you just turn on the vacuum and you place the plastic sheet over the vacuum former, and it sucks it down. You pull it off, pull the next one out of the oven, and so it's just a matter of seconds between each one. The longest step is the assembly, which is cutting the mask part, the formed part, away from the plastic sheet, and then attaching the straps and inserting the filters.
Thank you.
Do you have a photo of the end product?
I have it. So we're working on our MVP. So this is a 3D printed mask product that I'm working on at GW. We're doing clinical trials for it. But my heart is in Africa. And so I created this, and we're working on it. 48 hours is kind of a short amount of time. But it actually was able to form pretty well out of some plastic that I pulled out of my trash can. The shape of the mask, I just need to tweak the airflow a little bit to get around the actual component that's going to hold the filter. But I'm confident that we'll be able to do that by tomorrow.
Randall, are you aware of any toxicity of the materials that you are using?
Yeah, so we are targeting specific types of plastics. So we're looking at PETG, polypropylene, LDPE. So those are all plastics that are approved for use in medical settings already per the FDA. Heating them in the oven, that does pose some concerns with gases and things, you're right.
Okay.
Well, thank you very much.
Thank you.
Okay. Oh, and there's awesome appendix slides. All right. So team 12, we have Coveycraft. I don't see any hands. Who will be presenting for Coveycraft?
Hey, that would be me. Sorry.
Okay.
I don't have participants. So.
That's okay. All right. Thanks, Sonia. Let me know when you're ready.
Okay, I'm ready.
Okay, start.
In US, COVID-19 has resulted in unemployment of 30 million, the same as Great Depression era. Imagine its impact in Africa, where over 130 million people are acutely malnourished and the average daily income is under $4. COVID-19 in Africa has further aggravated the problems of poverty, poor quality of sanitation and health, and malnutrition. Next, we are not here to pitch an idea as a solution. We are here to talk about our MVP. What you see in my background video is a fully functioning digital platform that we created this weekend to connect 3 players. Trainers who want to enable and certify local workforce to learn new skills, makers who acquire new skills to produce essential supplies to protect their loved ones and sell them on Coveycraft Marketplace. Next. Coveycraft, next please. Coveycraft aims to create sustainable economies that will work during and outside the time of a crisis like COVID-19. Learn, protect, earn, that is our mantra. Next, earning bias trust is easy, and in future we will use AI and ML to establish a trust score to delist products and sellers who don't meet our quality expectations. Buyers and sellers can have forums to post their needs, which will also help keep the demand and supply ratio in check. Local delivery channels will ensure timely but reasonable deliveries. Next, trainers from across the globe can curate certified courses and help certify the makers to empower everyone, but trainers can opt to earn royalties on sales of products that were inspired by these courses. We have a fully functioning learning platform for online training and certification and personal fabric masks at home are already live on Coveycraft. Next. COVID has accelerated online shopping rates in Africa from 8 to 10% last year to over 37% now. Broken supply chains have proven that alternate local supply chains are a necessity, not an option. This is the opportunity to further augment online activity. Have developed Coveycraft as a fully functioning multi-vendor marketplace integrated with PageTag for payment and with Facebook store and WhatsApp for marketing and offline sales. We have already received 12+ leads from individuals interested in using the platform. Nigeria and South Africa. Next, one has Africa's Silicon Valley and other has strong purchase power. Next, please. Together, they have resulted in over $8 billion in online transactions last year. Next, we have 2 team members on the ground in Nigeria and South Africa. Logistics is a problem that we need to solve, keeping the prices low without reinventing the wheel. In Nigeria, we can partner with existing motorcycle couriers like GoCarda to provide affordable local deliveries. In South Africa, with supermarket chain like Pep, to provide store-to-store delivery, augmented using Coveycraft Couriers, which is a network of trusted local delivery people. Next slide. So in near future, we want to focus on onboarding expert trainers to create credible course content.
Thanks, Sonia.
And then step foot in Ghana and Rwanda. Thank you.
Okay, so we have 2 minutes from the judges for questions.
Sure.
So Sonia, this is Antonio. So in your platform, your path roadmap is first you're going to create these courses for makers, right? And then the platform will support also the logistics of delivering what is being done from different places. Is that it?
So we already have access to platforms like GoCarda, so we can leverage them today. The Coveycraft Courier is to augment the missing pieces. Like in South Africa, you don't have motorcycles at all, they are banned. So in those places, you can do store-to-store deliveries, but how do you manage the local deliveries? That problem we will address later on.
Okay, so the first milestone is the course creations, is that it?
The course creation with credible authors. We already have a live platform. So if you go to, can you forward the slide to the last one? The next is our team slide. So if you go to covid.86.co, the next slide, please. This platform is already functioning. So this is live, content creation and learning is live, but we need good, credible people to come and create courses.
Thank you.
Any other questions? Please feel free to go to the website.
Great, thank you so much.
All right.
Great work over the weekend. Okay, next up we have team 46, Ilara Health Innovations.
I'm here and ready to go.
All right, perfect. And then the last team will be Remway. Okay, let me know when you're ready, or James, you can just start.
Good evening, ladies and gentlemen, and thank you all for your time. Next. Team Ilara is here to do our small part in tackling the big, hold on one second. In tackling the big COVID-19 exacerbated core issues of poverty, community transmission, and job loss in our modest effort to flatten the curve. Our purpose is to passionately, competently serve the people in our communities via the manufacture of surgical masks, localizing manufacture, talent, and supply chain, and globalizing a technically sound African product. Next. Our strengths are a local supply chain, a labor force, and preferential hiring for displaced workers for COVID. We're a social enterprise donating 1,920 masks per month. We're environmentally sustainable, manufacturing with solar, plus recycling the products, and we have the machines. We have relationships with local solar providers, which is also a boost to our economy, and partnerships with local government already developed for regulatory and sales. Our weaknesses is we're undercapitalized and low technical training of the workforce. African market is large, manufacturing capacity is currently low, current supplies from China, and the market is ready. We currently already have orders from Somalia, Uganda, Kenya, and Rwanda. Next. This is our financials, and offline you can ask me for the full business plan. We have a net profit of 216,302. Each surgical mask fully loaded costs 7 cents. Current retail price is 50 cents. Regular price after COVID is 20 cents, so we will still be profitable. We need 400,500 capital expenditure for operating expenses for the first 6 months. Next, and we will be cash flow positive within 6 months. The impact we're going to have is produce 96,000 masks per month, donate 1,920 masks per month, create 30 jobs, and recycle the masks and upskill the workforce. And we are environmentally sustainable, solar power, and recycling. Next. We have a timeline. We will be ready for production in September. Next. 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 If you want to go far, if you want to go fast, go alone. If you want to go far, go together. Let's go the distance for Africa. Next.
And that's time. Okay, thanks, James, for pushing through even with some issues there with the volume. Okay, 2 minutes for questions from the judges. Nothing from our judges? Okay, well, thank you very much, James.
Thank you.
And that leaves us with Team Remway. Do we have a representative? I don't see any hands raised. Team 18. Okay. All right, I've unmuted you, Takumbo. Are you ready?
Yes, I am ready.
Okay. Go.
Yeah, so yeah, once again, my name is Tokumbo Oweru, and we all are no strangers to the current global health emergency. And we know that without any interventions, as much as 40 million lives can be lost to this pandemic. My country, Nigeria, currently has 2,388 confirmed COVID-19 cases. Lagos State, where I live, is the epicenter with 1,918 active cases, and there are 385 discharged and 85 deaths. We have a need to keep those numbers down. We have to flatten the curve. Our government has mandated social distancing, hand washing, use of alcohol-based sanitizers, wearing of face masks, and also PPE such as face shields for the healthcare workers. This need for social distancing has resulted in global lockdown, and the economy is crippled. Yeah, and businesses are shut. There is rising unemployment, and there's global scarcity of critical and essential items and PPE because of the sudden surge in demand brought about by the ongoing global pandemic. Locally, we also have a critical and urgent need for the sanitizers, for hand washes, for face masks, which we are able to produce locally. Now, our response to this problem, our solution is REMWE, an acronym for restarting and moving the wheels of economic activity. It is an initiative enabling decent work and economic growth. And we're piloting a project, which is the critical production of 70% ethanol-based hand and surface sanitizers, pH-balanced body wash, that also will double as a hand wash. And this body wash will not strip the skin of its natural protective barrier. And we also will be doing reusable, locally sourced 3-ply face masks. And we'll also leverage on USSD technology for order confirmation and payment, and do dispatch rider doorstep delivery. Nigeria has over 200 million people, Lagos over 40 million people. Our target market are hospitals, supermarkets, organization, hill riding services, and they will be reached through direct marketing, retail, wholesale distribution, and giveaway distributions to vulnerable populations. We already produce on a micro scale. Our sanitizer formulation is of 4 variants, and original and sensitive are the ones we're pushing. The sensitive is fragrance-free and dye-free for people who are prone to allergies, and we can also make customized brand sanitizers. With a solution such as ours, there will be accessibility to market, continued production of scarce necessities, reduced unemployment for critical manufacturing production workers, and also logistic personnel. And there will be virus transmission prevention through social distancing during doorstep delivery of
time. Thank you. Okay, I'll leave it on the team slide. We have 2 minutes for questions from the judges.
Tukanbo, did you want to finish that last slide? That would.
Yeah. You need to go to, there's a slide that shows our products. Yes, that. And that's me with our cotton surgical face mask.
Could you just quickly talk about the public and hygiene station?
Yeah, the public hygiene stations, we intend to put that at strategic locations for vulnerable populations. You know, places like motor parks for bus parks, you know, so they can use those things before boarding buses, and markets also. So that would serve them.
Thank you.
You're welcome.
Great, thank you so much. Do you have any other questions from the judges? Okay, well, thank you, Takumbo, for finishing it off for us.
Thank you.
So congratulations, everybody. Great work this weekend. We're so proud of everything you've done. You're so inspirational, and thank you for letting me be your track lead through it all. Hopefully you found this exciting and you're energized. Yes, a little, yeah, we don't get to clap for you, but hopefully you're feeling energized and you're looking forward to continuing this great work. The idea is this is supposed to be where you kickstart your idea generation, but the point is we want you to be implementing these solutions as quickly as possible on the ground. So during our awards ceremony, we'll be talking about the post-hackathon resources that we've been working hard to put together for you to help you implement these solutions in your home countries or where your heart is, whatever it might be, the case may be. So please, now the judges stay on, and I will put you into a breakout room to do deliberations. And everybody else, please click on or join this link and go to the webinar. It will be starting at about 3 o'clock. It will open about five minutes early, okay? So you have a little bit of a break now. Go take a nap for 45 minutes. All right, thank you.
Thank you.
Thanks, that was awesome.
Thank you. Don't forget, it's gonna be a great award ceremony. I can't wait to see who wins. Okay, so judges, I am going to, can the 5 judges raise your hand? Actually, you know what? No, I can do this more easily. I'm gonna put you into a breakout room. Sorry. Emmanuel, I can't hear you. Okay, Chibuso, David, I see Felicia, and I'm missing Antonio. There's Antonio and Ashvina. Okay, so judges, I'm going to be putting you into a breakout room right now, and I will join you there in a minute once once the participants start to leave this main page. But for now, you should all have your judging spreadsheets, and please start to update them. They'll automatically populate, so we'll be able to figure out the scores, okay? All right, I'm opening your room.